Welcome to Hemispheres, a stroke competency series by Apex Innovations. We know you will learn better when you see, hear, and do. That's why we build our courses with intelligent interactivity. Hemispheres is an always current stroke education series designed to cover just about everything you need to know about stroke and the care of the stroke patient. This comprehensive series is comprised of 8 levels of interactive stroke education that will increase your staff's knowledge of anatomy and physiology, stroke pathophysiology, pre-hospital and emergency department care, ischemic and hemorrhagic stroke care, stroke prevention, excellence in stroke care, and including the NIH stroke scale training and certification. Level 1 presents the basic anatomy and physiology of the brain and its supporting structures. Cerebral circulation is addressed with emphasis on the different areas of the brain and the vessels which supply them. Additionally, various types of strokes and their causes are reviewed. Level 2 covers the pathophysiology of the brain. Cerebral circulation is addressed with emphasis on various stroke syndromes. Types and locations of cerebral aneurysms are presented. Ischemic and hemorrhagic stroke are covered in detail, ensuring each learning variance is addressed. Level 3 discusses the stroke chain of survival, beginning with recognition of typical and atypical stroke signs and symptoms. Current and crucial aspects of emergent stroke care are reviewed in a comprehensive and logical manner following time-sensitive best practices. EMS and emergency department specific assessments, stroke scales, testing, and treatment are presented. Level 4 reviews the in-hospital assessment and treatment of the patient with acute ischemic stroke. Patient care is presented chronologically from hospital day 1 through day 5, presenting best practice guidelines. The goals of stroke treatment are addressed chronologically, and dysphagia screening tools are also addressed. Level 5 reviews in-hospital treatment of the patient with acute hemorrhagic stroke, including intracerebral and subarachnoid hemorrhage. Patient care is presented based on etiology of hemorrhage and possible complications. Medical and surgical care is also presented using best practice guidelines. Level 6 addresses primary and secondary risk factors as they relate to stroke. These risk factors are categorized as modifiable or non-modifiable. Risk factor medications based on current recommendations are presented to minimize risk of stroke and improve the quality of life. Level 7 addresses best practices and requirements necessary for designation as a secondary, primary, or comprehensive stroke center. Supportive stroke facilities are also discussed, as well as key elements, quality improvement measures, stroke collaboration, stroke response, and more. Level 8 of Hemispheres is the National Institute of Health Stroke Scale Training and Certification course. Thanks for watching this brief demo of Hemispheres. If you would like to know more about this series, or you are interested in reviewing all of the content of Hemispheres, please give us a call.